Welcome to the village. Okay, my guest co-host today is Marcia again. Thanks for being back here.
Glad to be back.
Yeah, glad to have you back. I wanted to talk to Marcia again today. Last time we spoke was our debut episode. I had mentioned that Marcia, besides being a registered nurse and a mother of two, is a sexual assault forensic examiner. The topic today is relevant for children, unfortunately, is abuse. We'll focus today on sexual abuse. Sexual abuse can be intermingled with emotional abuse, physical abuse, and we can touch on those things a little bit. I just want to start with the definition of abuse, and you can fine-tune this if you feel like there's a better definition. It's any form of mistreatment by an individual that causes harm to another person. So that in general would be any type of abuse and really any type of harm where somebody is really just the victim of somebody else's mistreatment. Mm-hmm. Well, I was reading that every 68 seconds an American is sexually assaulted and every 9 minutes it's a child. According to the Department of Health and Human Services, 9% of U.S. children are known to be victims of sexual abuse, and of course something like this is going to go underreported grossly. Right. I'm sure it's much more. Why don't we get into some of your work with this area?
Sure. So I received my certification through New York State as a sexual assault forensic examiner back in 2015. With the training and certification, obviously there's quite a bit of classroom instruction, but there's also quite a bit of hands-on exams. I have been doing exams on my own since October of 2015. We do retraining every year. We focus not only on physical evidence, but also trying to care for a patient emotionally, mentally, socially, all of the dynamics. I have also attended specialty training for pediatric exams. So a lot goes into it, and a lot is required to maintain certification and a lot of training. I think kids are particularly difficult in that the large majority of cases for a pediatric sexual assault are by persons that are known to a child. More often than not, the perpetrator of this abuse has mental health illness, they have problems, but they garner a lot of enjoyment out of their behavior, and they don't necessarily ever want this behavior to stop.
Okay.
So very rarely will you find injuries on children because perpetrators will purposely try not to injure a child, because if there is an injury, they know the behavior will stop.
Yeah.
So
they know they'll be caught.
Yes.
They're professionals at
engaging in this horrific behavior, causing minimal physical injury or evidence so that they can continue to abuse.
Because they have abused others, there's probably a pattern with them.
Right. And also, children are easy to emotionally, I don't want to necessarily say manipulate, but, more times than not, the perpetrator is someone that the child knows. A lot of times people who do this are very good at building a relationship with a child and having their trust. And this is a secret and all of these things, and I'm not hurting you. It feels good, right? And they know exactly what to say and exactly what to do to make this child feel like what's happening is okay.
And even if the child feels innately like there's something wrong, they would probably feel scared or guilty, like they don't want to get this grown-up that cares about them in trouble or that they care about in trouble.
Absolutely. I'm sure they, wonder, is this really wrong? The things that they're being told make sense. I'm not hurting you. I'm not this. I'm not. It is very difficult to identify pediatric sexual assault. It can be very difficult.
Yeah.
It's really important, I think, and all of this is opinion based. Obviously, I have a lot of training and a lot of experience with this, but a good portion of what I have to say is opinion based. I believe that the forensic interview is as important with a child as a physical examination, because when a child opens up and is willing to talk to you about what's happened to them, in the absence of physical evidence or injury, you have a much better picture of what's happening and you are much better able to figure things out and help them. So if you have a forensic interviewer who really knows what they're doing and is able to engage a child in an environment that's comfortable for them, that is part of like play and relaxation, and they're able to open up, that's really where you're going to find out what's happened.
And I guess that first person to question them is the most important person, because they could retract what they say. If more people ask them, they may start to realize that, well, this has become something serious, more adults are involved, and they may say something once and may never want to say it again.
Right.
They do say that from age 3 and on, children's history becomes more reliable.
Yes.
They're able to really talk to you.
Yes. They're able to more accurately verbalize what's happened. Under age 3, kids are much more likely to use pointing and answer questions or pictures to identify things. Over the age of 3, they're more likely to tell a story and to be a little bit more accurate in their recall of things that have happened. That forensic interview is extremely important. The more comfortable a child is with the person they're talking to, obviously, the more they're going to disclose and the more accurate they're going to disclose. So it's really important to get them to the appropriate place for their interview and with the right person.
How do you get them to that place? The concern is, how do we diagnose and not miss these diagnoses? The child isn't always going to come forth and tell an adult that something happened. In fact, more often than not, they probably won't.
Right.
So how do we look out for these things, and who is responsible? Does it all fall on the parent? Is it the teacher, a babysitter? I guess everybody's kind of responsible for being on the lookout for this.
Well, any nurses, teachers, there are certain professions where you are a mandated reporter. In a situation where a child were to come and disclose information to you, it's a mandated report to Child Protective Services. If a parent has a suspicion and brings a child to the emergency room, every emergency room has the ability to do a sexual assault exam. However, there are places called child advocacy centers that have setups that are much more conducive to a better outcome. In the case of certain hospitals, a child could present with an acute injury. And in that case, we would most definitely do the exam, document evidence, document what we've seen. We can do sexually transmitted infection testing. However, if it is a case of a parent presents with a child who's saying, 2 months ago, my daddy touched me here, there necessarily won't be an exam at that exact moment. There can be a phone call to Child Protective Services and a referral to a child advocacy center for a more appropriate in-depth interview with someone who is a specialized forensic interviewer.
Because the emergency situation is kind of past at that time.
Correct. So your focus really is going to be on getting that child the most appropriate, intricate services.
You mentioned like Child Advocacy Center. That's a place where you could potentially find a child abuse pediatrician who is a pediatrician who is trained and specialized in just child abuse.
You could, yeah.
So that would also be very helpful, because a larger interdisciplinary team.
Correct. And, I think too, in the case of a child sexual assault, there needs to be as much support for a parent or the parents as there is for the child.
This is traumatizing for a parent to hear about or even want to face.
Right.
I think some of the challenges in why this type of thing might get delayed is if a significant other of the abuser is the parent of this child, not necessarily a dad, maybe a boyfriend, girlfriend, stepdad.
Right.
Somebody who is close to that parent, and it's hard to then want to really fathom or face that that's happening.
Right.
That's one of the reasons some of these things get delayed. So it's hard. It's a trauma for everybody, and just a trauma to know that this is happening to your child. It's horrifying. With identifying then, it's hard to then tell parents or other family members to be on the lookout for abuse, because there are certain signs and symptoms that an abused child might show more prevalently than a child who is just having normal development. Right. With that, when finally do have a child recognized as somebody who could be potentially a victim of abuse, of sexual abuse, more specifically, you do have these resources of just the emergency room right away, and then possibly the nearest child advocacy center or pediatric emergency room. But just recognizing that that's something that should happen. Like if they didn't go in for an acute injury, like I was thinking about some of these things that some parents seem to know, but many parents won't know of a child's behavior. Is there something you can shed light on with how a child might behave? Like something that would raise some red flags that potentially this child could be abused by someone?
Kids can be more irritable. They can be more argumentative. They can be like less cooperative and not behave as well, not sleeping well, not eating well.
Yeah.
Start showing signs of like shyness or discomfort around certain people or certain groups of people. Act out in ways that's not normal behavior for them.
Yeah.
And I think that once parents start noticing things like that and it becomes a pattern of behavior, that it's something to question and look into.
I try to think about some of the physical findings too, like new onset abdominal pain, headaches, more nightmares, bedwetting at nighttime. I guess like since we're talking about children, we mentioned toddler age, but we could be potentially talking about children younger or children older, even teenagers. I think that's kind of an offshoot of this topic is teenagers and sexual abuse, which could include rape.
In New York State, if a child is aged 12 and older, they can consent to their own exam. 12 and older is considered adolescent adult and would be able to have a different exam per se. Huge misconception across the board about sexual assault in a population of 12 and older is that there are a lot of services that can be provided that don't necessarily include the, quote unquote, rape kit. So if I have a 14-year-old girl come to the emergency room and say she's been sexually assaulted, we're able to give her antibiotics. We're able to give her HIV prophylaxis. We're able to give her a pregnancy screening, lab screening, without ever doing an exam if she does not want to have one. So patients completely have the ability to pick and choose what they're willing to participate in. And I think the fear of the exam itself prevents a lot of patients from reporting this because, what do you hear about? They pluck your pubic hair. They do this to you. It's so invasive. We would much rather treat a patient with the medication they need, set them up with rape crisis counseling, set their families up with support, and do all of those things, even if they don't want the police contacted, if they don't want to consent to the exam, if they don't want photographs. They don't have to have any of those things, and we can still help them and treat them.
Yeah, because if you were just violated in a certain area of your body, you're not going to go asking somebody to look at that part of your body.
Right.
But you would potentially go and tell somebody, I need help.
Right.
Actually, I'll just mention quick, since we're on this topic, there's an organization called the Rape, Abuse, and Incest National Network that has a website, www.rainn.org. I'll say it again, www.rainn.org. And they have a lot of resources and help and a hotline and stories. So there's survivor stories. I was thinking of a patient of mine, thinking about how scared she was when she finally came and told us what happened to her. Hearing that other people have been through something like this and what you can do. That's us delving more into like the adolescent age groups. It sort of melts into each other, right? So if a child was abused as a toddler or school age, that could potentially set them up as someone more vulnerable to be abused in the future.
Absolutely. Absolutely. And anyone who has suffered any kind of abuse, physical, emotional, sexual, any kind of abuse, definitely suffers from the mental health repercussions of that. When you're not able to have that addressed and have that treated, it definitely sets a tone for how you will have other relationships in your life. It definitely can make you more susceptible to abuse in the future as an adult, or more likely to be in a relationship that includes intimate partner violence.
Because it makes you feel shameful,
right,
guilty, like you did something wrong.
Right.
Like victims of abuse are often, and any kind of abuse, like you're saying, even emotional, physical, sexual abuse are all meant to make you have self-doubt, so the abuser can victimize you.
Right.
So that self-doubt will keep you coming back to abuse that maybe you don't recognize as abuse, or you feel you deserve somehow, or you feel is your fault, like you said with relationships.
And abusers are very, very smart.
Yeah.
They're very, very smart.
Like you said, they don't leave a mark on kids. I mean, what's smarter than knowing how to get away with it?
Right. They're smart. They're manipulators. They're often narcissists. They're very clever at coming up with different things to say, different things to do.
Yeah.
But they know how to manipulate and turn tables, and children are so vulnerable to abuse because they're innocent.
Yeah.
And a lot of times as teenagers and adolescents, adults, it's oftentimes the really compassionate, the fixers,
the
empathetic souls that are more likely to be abused because they will tolerate and they will try to accommodate. And
they know how to be guilt tripped and
Yes.
make a person feel bad for them.
Right.
I actually had a 13-year-old girl who said she lost her virginity at age 13, and she was the sweetest little thing, and she still is. She's about 16 now. The mom brought her in because she found out, she saw a card for Planned Parenthood, so she asked her daughter, and the mom is very, like a sweet little mom. She just does not know how to even get mad, she just gets so worried. So she said, come talk to your doctor and let's see how we can at least help you, make sure you're healthy since you started having sex now. Like, we need to make sure you're okay. She came in and I tried to understand what made her decide to start becoming sexually active at this age. And she said she wasn't really thinking about it. She wasn't really interested in it. But the boy, who was maybe 14, 15, not that much older, she said it was something that he said that made her feel bad for him. Once she started becoming sexually active, it just didn't stop from there. Now she just finds it normal and just something she's interested in doing.
Right.
Like, I try to understand from young girls who become active so early what triggered them, and there's a lot of things for a lot of different people, not just girls, but just people, why they do what they do in this realm. And that was what started for her, and once it happened, it kind of opened a doorway of normalcy.
Right.
In that way, I felt like, she wasn't molested, she wasn't raped, but she was kind of manipulated. It is a kind of abuse.
Right. She was definitely taken advantage of. I think that happens a lot with teenagers, young adults, even older adults. Sometimes your abuse becomes your normal. And it's maybe not the outward bruises and bleeding and physical signs of abuse, but it's the day-to-day constant abuse that becomes your normal.
It's just so intertwined with your mind that you don't recognize it as abuse anymore.
Right.
And I guess that's why this is so important when you think about child abuse, to then become an abused person in adulthood, that vulnerability, because chances are higher that you came from a vulnerable background to begin with, that you were able to be abused. I think there's some risk factors that children who are abused have. They don't all have it, but some risk factors are present. What are some things you would say exist in maybe a family or a child that makes them more prone to something like abuse?
I think there can be a lot of different factors. A lot of times it is, your poverty level, your education level. Families who are under a lot of stress, maybe don't have jobs during the day. Those kinds of things can make it more susceptible. a lot of mixed families when you're involving step parents, step siblings. That kind of situation can make you a little bit more susceptible where you live. If you live in a very poor community, certain behaviors are more common than in other places.
Definitely, I think stress levels in families, having multiple people in and out of the house that are not necessarily keeping an eye or keeping a check on the child. When parents don't have a choice but to leave them with a babysitter, a stranger, or somebody where you can't guarantee who's in and out of the house, or older teenagers with friends coming over, or different places that they may be taken to that you can't always keep an eye on.
And we're in a day and age where everything is accessible on the internet. Immediate. Teens, preteens are doing things now that they know they shouldn't be. They're doing things that they know are awful, all for a shock factor. All for the, I'm going to show this to my friends. So-and-so did this, so I'm going to do this. And it's going to be even more unbelievable. And things are just immediate, and they're broadcast. And outside of abuse, for doing a lot of behavior, engaging in a lot of behavior at this age because of that. And if they want to find something out, you look it up on the internet and it's immediately
Google
there.
it.
And so adults who abuse children who are looking for information on how to do this in a smarter way or not get caught, this information is available. That also is how things are a little bit different now and puts you more at risk because things are so accessible.
And so how do we combat this? And you could be the most loving parent and the most protective parent, but your child is still at risk for one reason or the other. So how do you ensure, or at least do the best you can to ensure your child's safety? How should you be on the lookout a little more for these things?
Definitely, there has to be a lot of education, even when your kids are little. Education. I think it's important to, when you're talking to your child about their penis or their vagina, to use those words. We sometimes do a disservice to kids by calling it a cookie or a this or that. You know what I mean? Like parents come up with, it's uncomfortable to use the words all the time, especially with your kids. So we come up with these clever little names. But then if you have a child that's trying to explain to you that something's happened to them and all they're talking about is their cookie, it's really, really difficult to understand what's happening. So use correct terminology, talk to them, educate them, communicate is a big thing. As kids get older, monitor the best that you can. And it is really, really hard right now because that little phone, that whatever it is, whatever they have, and these apps and all of these things that, come and go, it's really hard to monitor what they're doing. But, there are ways that you just have to keep an eye on what they're doing and really talk to them. Ask a lot of questions.
That's really great advice. The keeping in communication with your child of all ages, asking them how their day was, if anything happened, anyone bothered them, because there's lots of things that could bother them. There's bullies, there's something hurt them. Just checking in with them, monitoring their behavior, like we said. Are they anxious? Does something hurt?
Right.
Has something changed? Be like a safety for them, someone they can talk to. Someone they feel safe to talk to, because if they feel safe telling you, then they're more likely to tell you.
Right.
Rather than waiting or never telling you.
Right.
I'm a big proponent of keeping kids involved in activities and hobbies and things that kind of keep them happy. Kids having good self-esteem by recognizing their talents and their skills and their hobbies and being involved with a group or with an activity or with something that means something for them that they can be a part of. They're more likely to be monitored by other adults, and they're also more likely to feel good about themselves in a way that can combat the self-destruction or the shame that comes along with abuse. So you know what I'm saying? Like, if they're less likely then to be a victim of anybody's abuse.
Right.
Ever.
Right.
If they feel better about themselves.
Right. And like you said, a 13-year-old girl who wasn't sexually assaulted, but maybe manipulated into a situation she wasn't ready for. Girls, boys who have stronger self-esteem. are more willing to say, no, I'm not really wanting to do that.
That's not something I want.
Right. When they feel good about themselves, they definitely have a stronger backbone to stand up to that kind of behavior.
Absolutely. Exactly.
And withstand the fallout that's going to come from, what do you mean you won't do it? And
so would do it. Or,
right.
I didn't think you were cool anyway. And,
right. All of the awful things that teenagers have to say.
Yeah, that just reminded me of a story. And this was me in college, and I was out dancing with friends, and I had a guy come up to me and try to dance with me, and I told him I didn't want to. And he said, I didn't want to dance with you anyway. And I was like, well,
yes,
good.
you did.
Well, you just came up to that was just just reminded me of that. But then that, okay, that's okay. I don't need to.
Right.
Dance with you. I'm dancing with my friends. I was much older then, but of course it starts somewhere. And having said that, since we are talking about some teenage things, I was just thinking too, the role models for teenagers and kind of trying to push them towards some of the more stronger role models rather than the ones that are maybe getting undressed or
the YouTubers or the
yeah. I mean, sexual abuse is happening to boys too, but
absolutely,
just kind of respecting your body and teaching our youth how to respect their body.
Mm-hmm.
Don't show what you don't want to show. Don't dress a certain way because everybody's dressing that way, or because you think you're going to impress somebody by dressing that way.
Right.
How did you manage with your daughter, because she's adorable and appropriate?
Fortunately for me, she just never really loved to wear things that were very revealing or, she's super athletic. So she's more of a sweatpants and t-shirts or athletic shorts and tank tops kind of girl. So she never really got into the whole short shorts or cutoff tops and that kind of thing. But I think she does have good self-esteem.
Yeah.
And she definitely is strong in what she believes in and doesn't kind of swing along with a crowd all the time. She really follows the beat of her own drum.
Yeah.
And now she's 20 and strong and spectacular. And
20 is still adolescent age.
It is.
And so she understands the most beautiful person is the person in the mirror.
Yeah.
Yeah.
Well, I hope she does. Yeah.
Yeah. How do we treat, whether it's the little ones, school age, or teenagers, adolescents, once they have been abused, how do you teach them and treat them and help heal them? I think that's the key word with any kind of abuse is healing, right?
Right. Identifying what's happened, obviously, has got to be the first step. Getting the appropriate tools in place. Local level, every county has its own rape crisis intervention counseling center. We have it in Fulton, Montgomery County, Albany County, Schenectady County. They are a wonderful local resource. I would venture a guess that pretty much every single county has their own local level rape crisis intervention. And they're excellent at getting resources for counseling, for therapy. If there is any type of legal ramification, they will accompany you. They'll talk you through it. They're experts in helping families and parents dealing with children who've been sexually abused. So I think it's got to be the follow-up. The physical wounds heal in a relatively short amount of time.
Sometimes you don't see them, right?
Sometimes there aren't any.
Little kids, you may not see them.
So it is most important to have a network of people and resources that are going to be able to continue for a long period of time, because the ramifications of pediatric sexual abuse will go on for years and years and years.
Yeah.
It can affect your sexual relationships in your future. It can, it can affect a multitude of things. So to have a network for a long period of time is really important, and finding the right place to set you up with those kinds of services. And again, like family services to help parents deal with it, to help siblings deal with it.
Like a family counseling.
Yeah.
So really getting the county, who should be contacted in the county?
In Fulton, Montgomery County, we have rape crisis services of Fulton and Montgomery County.
Through the public health?
Yeah, I mean, you definitely could get the number through public health. You could get the number through the emergency room. You could go online and look up Fulton, Montgomery County.
Or the child's doctor should have those kind of numbers.
Pediatrician should have those numbers. Yep.
Okay. Or somebody like you who
Absolutely.
you would just give them the information they need. So once the child is identified, which is probably the toughest part, neck and neck with healing once they're identified.
Right.
To get them to be examined and then get them to the crisis phone number.
Right.
And they'll help with setting up with therapy, potential family therapy. And it should be like a long-term therapy because the psychological injuries may be deeper than are really recognized. So lifelong, or at least throughout their childhood, teen years, when they do start to enter relationships, check in and see how you're dealing and if you do need therapy or counseling then. The other thing with kids is music, play therapy, drawing, journaling, writing if they're of the age to write, to get some expression out there. Because when we say the word healing, that indicates that there is some kind of pain. And that pain needs to be recognized and released in some way.
And everyone heals differently. So if you're in a situation where you have the opportunity to work with a counselor, they will find the way to best help healing and the way that works for you best, your child the best. And it's possible they can try different types of things, or different things will work as a child gets older. It's really important to be with the right people who know how to help.
And just to realize that this has happened and not sweep it under the rug.
Right.
Because it's not going anywhere.
And like you said before, to be involved in support groups. Generally, rule of life, nothing helps you cope with a situation better than to know that other people have had to do it and have done it successfully and came out okay from it, and you're not alone in it. A situation like this, a lot of people don't really come forward and get excited about talking about their history of abuse.
Yeah.
So when you're one of the people that it's happened to and you kind of are able to connect with a group of other people that this has happened to, that's very therapeutic.
Yeah. You can almost mirror your feeling with somebody else. Have you heard of this Child Help National Child Abuse Hotline?
Yes.
It's like a 24-hour thing if you're not sure what to do?
Yes. I think that's more about helping you have information on how to report a child abuse. Yes. A resource for parents who are looking to, what do I do because I think this has happened?
Somewhere to start from scratch, just not knowing.
Right.
We've had parents call the office too, pediatric office. But this is good for me to know too, all pediatricians to know, because I don't think we always know exactly where to go in what situation if you're not a child abuse specialist.
Right.
I guess just to make sure that people have the right resources for age group, childhood, toddler age versus school age, it's pretty similar where to go from there and what to do, right? With teenagers, I guess if it's an emergency situation and if something just happened, an emergency room setting is the first place to go.
Yes. And for a child, most definitely.
Okay.
At any situation, you can definitely go to an emergency room and get the resources that you need. The most appropriate place for 12 and up is always going to be an emergency room. Smaller children, it's definitely an emergency room, child advocacy center. Go to your pediatrician and get set up with. Circumstances with kids are so different. Teenagers and, older adolescents, adults typically will report an incident with a very short amount of time after it's happened. Okay. Most of the time within hours to a day or a couple of days. And it's a little bit different with younger kids. The abuse could have happened months ago.
Yeah, even years.
Yes.
Yeah.
Yes. But an emergency room is never going to be a wrong place to go. They'll will always get you the information you need or refer you to a more appropriate place, get you the exam that you need, whatever needs to happen.
So if a teenage girl finds herself in this situation, she can go to the emergency room. Can she also go to the police?
Yes, absolutely. And we have had police actually drive girls to the hospital. So they make their report and then they come for an exam. Like I said, I think a huge misconception and what holds a lot of people back from reporting a sexual assault is that they think it comes with a certain amount of strings attached.
Yeah.
I have to report this to police. I have to have this exam. I have to let them collect evidence. I have to let them take photographs. And none of those things are true. So there are a lot of things that we can do to treat patients without any of those other things happening. You are the boss of your exam, and you get to pick and choose whatever part of that exam you feel comfortable with. I've had patients come in who strictly just want prophylaxis STD treatment. They just want antibiotics.
Pregnancy treatment.
Yep, we can do Plan B pill. And that's perfectly okay.
Yeah.
That's totally their decision. And that's why we're there, to give them the treatment that they're looking for.
And they don't have to tell their parent.
No.
We encourage them.
Age 12 and older is old enough to consent on their own.
That's perfect.
Yes.
I mean, it would be perfect if it didn't happen.
Right.
But we have a good setup for them to feel safe to get the help they need.
Yes.
Are there any other resources you can think of? I mentioned rainn.org, rain.org. The local county you had mentioned, the 1-800-4-A-CHILD, which is the Child Help National Child Abuse Hotline if you're not sure what to do, your doctor's office, the emergency room.
Well, yes, like you said, your local rape crisis center. But yes, always your local rape crisis, county by county, will be a good resource too. And if you really don't know who to call your doctor or emergency room, and they'll be able to get you the number that you need that's appropriate.
Yeah, there's always help. One thing I wanted to mention is, and I'm called like the eternal optimist to a fault sometimes. When someone's abused, whether it be a child, an adolescent, an adult, any kind of abuse, if it is recognized eventually by them or by somebody else who can get them to recognize it, and the healing can begin, you can actually become a stronger, more successful person from recovering from this abuse.
Absolutely.
Or if you can call it recovering, or at least surviving it, I guess is a better term.
Absolutely. And become a wonderful resource for someone else who's gone through it.
Yeah.
Like we've said over and over, there's nothing more reassuring or more helpful than seeing and speaking to someone who's been through what you've been through and has come out okay.
To show them that you can get to where I am one day and you can talk about it more easily. So just trying to really gain that strength from, well, I've survived this and I can really do I can do anything now.
Right. Right.
Yeah, having that ability to break down walls and gain strength and just be a stronger person, a smarter person, a more educated person, and someone who's willing to do a lot of things.
Right. And I do actually have this number for the Fulton Montgomery Rape Crisis Sexual Assault Advocate. It is 1-866-307-4086. And that is the Fulton Montgomery Rape Crisis Sexual Assault Advocate.
There would be similar advocates for
County
counties
by
in
county.
Different places.
Mm-hmm.
Well, that's perfect. Is there anything else you want to say before we wrap up, or as a wrap up?
I think it's just important that people know that it's okay to ask for help. Whether you're a parent who is terrified that you've discovered something has happened to your child, whether it's a teenager who's had something happen, is afraid to get their boyfriend in trouble or their girlfriend in trouble. If you are an adult who is in a bad situation, it's okay to get help. You're not the only one to be in a situation like that. There is a lot of help out there and there are a lot of resources. So much better to get the help than to suffer quietly.
Some great advice.
Yeah.
Well, thank you again.
Thanks for
being
having
here.
me back.
Yeah, it's been awesome, as usual.
It has been.